Are you a chiropractor with a struggling practice, having a hard time finding and keeping patients? Is your staff falling short of expectations? I'm Dr. Scott Sawyer, and DC Trainings has the answers that you need. So tune in now and find out how.
Hello, everybody. Welcome to DC Trainings. I'm Dr. Scott Sawyer. It's great to be with you today. We're going to dive into our next section of Module 2, which is the new patient module. And today's topic is the CA examination. And it's great to see some of the CAs on our call today because as you are aware, it's whether you're learning to do the exam as a CA or whether you're already experienced in doing the exam as a CA, the participation that you have in this part of the new patient process is really valuable. It builds a huge value for your new patients to have a team working with them, right? To get the information, to get the details. And that all, I mean, that's just a huge value added piece. There's another part, and that's where my mind started to wander, and that is it breaks it up in terms of the new patient process. Doctors, what you'll be able to do is go in and do your part of the exam, excuse me, and then finish your part of the exam and leave and go and adjust patients and take care of patients while your CAs go in and do their part of the exam. So it breaks up the flow a little bit in terms of having that value for the new patient and experiencing different people on the team. And it also adds value because doctors, you can actually put your new patients in during your adjusting times and then break away to adjust patients while that new patient process is continued. I'll even take it a step farther, and we'll get into this in our webinar today, but if you have a CA who's, at least for those of you who are in California, if your CA is certified to take x-rays or do additional tests, then that also becomes part of the CA's process, part of the process in the exam process. Sorry, that was a mix-up of words. So it's really just, again, a great value-added piece to this whole sequence. So let's dive in, and if you're hearing the sound quality, I'm trying something new. I'm speaking into a wind tunnel today. You can hear the mic is kind of off. We're testing out a new sound approach here. Just kidding. The mic is not so good, so I might have to get a new mic. But anyways, I apologize. I'm sure you can hear me, but it does sound like I'm way back there somewhere, and that's what that's from. All right, so let's go ahead and get into this part of the process because, actually, let me just actually go back. Oh, hang on. I'm bouncing around a little bit here. There we go. That's what I needed. And bear with me. There we go. Oh, no, that's not it. Okay, so let me jump back over. I think this is it right here. Yeah, this is it. Okay, sorry about that. Okay, so let's jump in because as you can see, this is already now week 6 of Module 2. So we're moving right along. We talked about the memorable welcome in the beginning, really setting that first impression with your new patient when they first come in. Then we talked about subluxation education. For many of our patients, this is the first time they've ever heard the word subluxation. So there's that educational process in terms of building an understanding and helping your patient to really identify what this condition could be that's causing their health problems. And then we got into the consultation details where we really dove into or unpacked maybe all of the health challenges that this person may be having. It may be more than what they just came in presenting with. There may be a long list, or at least a longer list, of health challenges that they're having that potentially could be helped with chiropractic care. So in the consultation details, we talked about how to really unpack all of those challenges that they're having. And then the next section, we talked about how to condense that into what we call the primary concerns, the top 1, 2, or 3 health challenges that really are the top priority. And as you get this flow down, the reason why I'm emphasizing this is because the better you identify those primary concerns and their effects on a person's lifestyle, the higher conversion rates your report of findings will be, the easier the report of findings will be, and best of all, the better your retention will be, meaning that the patient will stay with you for longer and you'll get better results and they'll get better results, you'll get better results, they'll get more lasting results and benefits and they'll stay with you for much longer. So that's why we want to identify those primary concerns. And then last week we got into the DC exam, which is the tests and the spinal palpation and the identification of subluxations by the doctor. Now, here's a question that came up this week in an email that I was answering. The question was, why not do the CA exam first and the doctor exam second? And that came in from a CA she had kind of a medical background, and her experience in medical practices was that there was a medical assistant who came in first and identified basically the vitals, right? They take your vitals, they take a brief history, and then they send the doctor in. In the way that I'm teaching you, this will actually add more value, because by doing the DC exam first, the CA exam becomes a customized list of specific tests relative to what the patient is presenting for. Okay, and I'll say that again a little bit differently. If the doctor identifies what the cause of the problem is, then those tests that are needed after the doctor's exam are much more customized for that particular patient. So they'll feel like this is not just a routine run-of-the-mill, they do this for everybody process. They'll feel like, hey, this is being catered exactly to me and what my needs are as a new patient in this office. So that's why we want to make sure that the CA exam comes after the DC exam. So just to recap, as we jump into this, the beauty of this section is it breaks up the new patient flow for the new patient, which adds value. It also breaks up the new patient flow for the doctor, allowing the doctor to go out and adjust some patients while this part of the process is happening. You can do this during your patient times, and these tests become much more customized, or at least that's the impression it creates, when they're ordered by the doctor based on the doctor's exam, not just this is how we do it for everybody process. Okay, so let's get into how this works specifically. So remember, the doctor just left the room and the CA now comes back in. The doctor left the room with the statement of, you have subluxations. And for those of you taking notes, you should write this down. You have subluxations. I've identified them. Now we're going to find out how advanced they are. Okay, that's a really important distinction in this process. We found the condition that is likely causing these health problems. Now we just have to find out how advanced that condition is. Now, if you've ever had patients who were concerned about getting x-rays or how the new patient appointment is taking too long, these are those added value steps that will just eliminate that concern. Because when somebody values something and realizes that this is a serious condition, the length of the appointment fades away, their willingness to follow the doctor's recommendations to get better results definitely goes way up. So there's lots of great changes that happen. Okay, so on the screen, it says within 2 minutes of the DC's departure, meaning quick. We don't want the patient to sit there and have to wait for 20 or 30 minutes. We want the CA to come right in after the doctor, meaning the doctor walked out of the room and said, hey, I've got a patient here with a serious condition. We got to get on this quick. That's the impression that the patient gets from after the doctor left the room. So CAs, you got to come in quickly right after that. You're going to go in and have, as it says on the screen, increased concerns about the doctor's exam findings. So CAs, when you left the room, let me jump back over. When you left the room, after the consultation, the tempo, the impression was, hey, it sounds like you have a subluxation. The doctor's going to find out for sure, but I really hope we can help you because obviously you've been suffering. So I really hope we can help you, right? Now the CA comes back in and there's an increased level of concern. Wow, the doctor needs these tests right away. So let's go ahead and get started. I want to get these right away for the doctor so he can further or she can further assess your condition. So there's that increased level of concern and empathy for what the patient's going through when the CA comes back in to complete that part of the exam process. So here, let's jump back over. Okay, so then from there, we're going to go through the exam. Now, since the exam by the doctor confirmed the existence of subluxations, what that means now is we're going to go into this next phase of the exam, which means that these exam tests should emphasize that which the doctor already found. So they should actually dramatize the condition. they should also be recorded, right? We want to have that recording in effect. Now, I just had a new patient this week who was very chatty, and he's a really nice man. He was actually referred in by another patient, and just the nicest guy. And I definitely wanted to make a good impression with him, because the patient who referred him in has been a patient of mine for over 25 years, a long time. So, you know, he's a good friend of hers, and she referred him in. So I wanted to make sure we had a good impression with him. And when I walked in the room, his response to meeting me was that he felt he should recap the entire consultation, the whole thing. He wanted to just share it with me again. Now, I don't really need him to share the whole thing with me, because my intention going into this was to do my exam to find out the subluxations, and I already had the whole history from my CA with my notes from the consultation details. So as he started really kind of deliberately explaining the whole thing all over again that I knew he had just explained to my CA, I said, you know, Bob, hold on just a moment. This is all very important, and I need this information. For just a moment, I need to focus, because I have your file, I've reviewed the information, and I'm going to check your spine very carefully to determine if you have something that we can help you with. And if you can, I'll let you know. But in the meantime, if you don't mind, I'm going to go ahead and record my findings and document exactly what I find based on what my assistant gathered a moment ago. Now, you can imagine that his whole tempo changed in terms of him trying to relive the whole story all over again, because he realized the doctor was telling me to be quiet. Now, of course, I was doing it in a loving way, but that was the focus. So the minute I turned on that recorder, I didn't hear a peep from him for the whole exam. Okay, now let me just reiterate that. I said, all of this is very important, and I need to document all of this. But for just a moment, I need you to be quiet so I can talk into this recorder. Now, I'm saying this back on the DC exam part, right? But I'm also relating it to now for the CA exam, because CAs, you're going to need to have that response in your quiver, if you will, because you are going to have patients that are chatty, and they can run on repeating what you already know from the consultation, and we don't want to waste time with that. That's not as sufficient as we want to be with our new patient process. So I just wanted to share that with you. Let me jump back over, and we'll go through this. So record your exam findings. It will greatly increase the effectiveness and the efficiency of the exam process, and it will allow you to expand on your own findings in a way that will dramatize the condition and the patient's understanding of the condition, right? We want to record those for effect. And the way that would look is I might say, today is a chiropractic exam on such and such date with so-and-so patient. It's a continuation exam from the doctors, something like that. So, excuse me, name, date, and it's a continuing exam. That's all you need to say to start it off, and then you go right into your test. Now, you're probably wondering, what tests are we talking about, right? So let's go into that. Here's some examples. You want to have the patient moving around, right? This, so far, for most of our patients who have not been to a chiropractor before, or have not been to a chiropractor who does this type of process, they've been in the typical doctor's office, which means they didn't have exam. They had a couple of poke and prods to see, is it sore there? Is it sore there? Oh, let's go ahead and get you adjusted. Or, oh, here's a prescription. Go pick this up at the store. That's the extent of this exam process that many of our patients have gone through. And I know there's exceptions, so I'm not trying to stereotype too much or generalize too much, but you get my point. Most of our patients have not been through this kind of a detailed and educational process. So I have 3 categories for you to do in your exam, which is the seated part first, standing part second, and last part is walking. What does that mean? In a seated position, you can have the patient sitting on a chair or on an adjusting table, either way, but you might do cervical tests, right? Cervical range of motion, rotation, flexion, extension. Those types of tests can be done in a seated position, because the CA can be positioned in a way that they can move the patient around as they're doing the test. You can also do some shoulder depression tests, or shoulder cervical compression tests, hyperextension compression tests. These are orthopedic tests that a CA can do when they're trained properly, and they will elicit an underlying subluxation, and they can be done in a seated position. So you might start with those 2 or 3 or 4 tests in a seated position. And I want to just preface something, because for all of us chiropractors, we use different techniques. I mean, none of us are exactly the same. So if you have other tests that need to be incorporated into your exam process based on your technique, please do so. I'm just going to emphasize the one that I feel will dramatize the subluxations in the most effective way. So those are some examples of seated tests. Some examples of standing tests would be when the patient's standing, you could do, for example, a Kemp's lumbar test, or you could do lumbar range of motion, right? Those are some good examples of standing tests. How about walking? Walking, there's one test in particular that I like to use, which is a balance test. We call it the heel to toe walk. So you can watch the video to get more of that, but that's an example of a walking test. So you could do a Romberg's test, like a balance test. That's another example of a walking test. So choose the test that you want to use to emphasize the subluxations and that a CA can do. Now, I do want to emphasize something, and that is that a CA cannot interpret the results of the tests. Now, what do I mean by that? This is maybe more specifically for California, but in California, a CA can do these tests as long as they're not interpreting the results of the tests. So a test can be positive, it can be negative, it can have a certain degree of motion or a certain restriction of normal motion. Those are all tests that a CA can do. And then once those tests are gathered, the results have to be analyzed by the doctor. So it's great because a CA can participate in these tests, gather the information, and then from there, the doctor is going to evaluate that and determine what course of care needs to come from it. So in this process, my exam is about 5 minutes. Now, again, based on the test that you want or the patient's individual condition, yours might be longer, it might be shorter, but that's just an example of the ones that can be used by a CA. Now, from there, we're going to pause once it's done. So you would stop the recorder and say, that concludes our exam, turn off the recorder, and write down the findings on the consultation detailed form. I want to just point this out for those of you who aren't familiar. On one side of the consultation detailed form is the handwritten notes from the consultation. On the back side of the consultation form is the examination form to use. So you can just take your notes from the consultation. Excuse me. Right with that. And then you can just flip that page right over and write on the back of it with your exam findings. So that way it's very seamless, and it's very efficient. So once the CA has added those notes, then we want to make sure that we go on to the additional testing, right? Now, in my office, we can do a thermal scan, we can do an X-ray, or we can do both. Those are the extra tests that we have. You might have a bilateral weight scale. You might have a postural exam. You might have other tests that you want to incorporate with these findings, and that's great. These would come next because, again, the impression that the patient has is that these tests came from the doctor's examination, which came from the consultation, but the doctor's examination determined that these specific tests were needed to be done by a CA to further assess their condition. So from the consultation to the doctor's exam to the CA exam, and then on to the special testing if you have that in place, okay? So that's the sequence and the flow that we go through. Now, let's go back to here. Okay, so once that's done, then we're going to move on to setting up the next part of the appointment, right? Because once that testing is done, the patient sees and understands now that information will have to be reviewed carefully by the doctor, right? So here's on the website, there's a CA exam. You can see that and review that. I'm going to come back to that on the website in a minute. But once the exam is done, then the CA escorts the patient to the reception, right? The CA is going to now take the patient up there. And from there, they'll schedule the report of findings. The doctor's part came first, then the CA. Now, I want to just pause for a minute because I just thought of something that will apply in many of your cases. Many of us don't have CAs that can take x-rays or do those extra tests. So I still like to break up the sequence, doctors. Do your exam, right? Have your CAs help you with the consultation. Then do your exam. Once you do your exam, have the CA come back in and do their part of the exam while you're adjusting. Then, if you're going to take the x-rays, while the CA is doing the exam and you're adjusting, that's fine. Then have the CA bring the patient back to where you're going to be taking the x-rays, and you go back and take the x-rays. I don't know if you can hear that, but there's somebody running a vacuum cleaner outside my door right now. I apologize. But then you're going to go back in and do those x-rays. And during the time that you're taking the x-rays, the CAs can be loading up the rooms or the tables again, or the rooms, however, and getting those patients ready to be adjusted. So it breaks up that flow again so that you can see patients and you can see new patients at the same time, breaking up that flow and allowing you to serve more people and be more efficient and have patients not waiting too long. Okay, so I just wanted to share that with you. Now, let's go back to the PowerPoint, because the CA now takes the patient up to the front desk to schedule the report of findings, and we're going to use the details from the summary of charges, which I'm not going to go through that whole form right now because that was last week. So if you're not clear on how to use the summary of charges, which, as I mentioned, is one of the top 5 or 6 forms in all of DC trainings, it's that important. If you're not clear on how to use that, go back and watch the webinar from last week so you can get that information. So once that's done, though, the CA at the front desk will will schedule the patient for the report of findings, and the exam CA goes back to doing what they're doing with the new patients. Or, and let me just pause, because I know some of you have, you have a smaller office. You may only have one CA, right? If you only have one CA, doctors, while the CA is doing the exam, you're going to go and run the front desk for a few minutes. It's okay. It's all right if you do that, because again, we want to maintain that impression, that rapport, that value. We want to have that in place. So if it means, doctors, that you're going to go and sit at the front desk for a few minutes while your CA does the exam, don't miss that. What I don't want you to do is say, oh, well, I only have my CA at the front desk, so I'm going to do the doctor's exam and I'm going to do the CA exam, or I'm just going to make it all one doctor's exam and I'm going to take the x-rays. No, you want to create value, and by building value and having your team involved, it streamlines your practice. Okay, and it's much more efficient. So don't miss that opportunity, even if you don't have extra people on your team to incorporate that yet. So what are the key encounters between a CA and a patient? There's the memorable welcome, as we talked about in the flow, right? Then there's the consultation. Then there's the CA exam, right? In between the consultation and the exam is the doctor's exam. Then there's x-rays, if your CAs can do that, or maybe your associate doctor does that. Either way, these are the 4 key encounters between a patient and your CA. So it is broken up, I understand, but that total involvement with your CA is about 20 minutes. Okay, that's about the time frame that you want to allocate to this. And this is all in the interest of keeping our new patient appointments down under an hour, right? We want to keep that appointment relatively efficient. So watch your time, make sure that it's efficient, and you'll have much happier patients. So that wraps that up. So next week, we're going to get into the new patient completion, and we're getting very close to the end of module 2 already, right? Time flies when you're having fun. So let me just jump out of here, and there we go. And I'll jump back over to the website, because on the website, there we go. Okay. On the website, we have our materials. And in our materials for today, there's 2 of them. So I'm going to scroll down here. We have the CA exam outline and the CA exam script. So I'm going to start with the outline. Oh, I'm sorry, here's the script. So we'll start with the script and then we'll go to the outline. So it says here, and this is the CA describing the exam to the patient and then actually doing the exams. And what I want you to get from this is that this is literally how it's recorded. So the CA, just like the doctor's exam, is talking at the recorder. They're not talking to the patient while they're recording the exam. They're talking at the recorder. So it says, first the CA says to the patient, if you feel any tightness or pain during the test, let me know so I can document them correctly. So, and then they start the recorder. This is a recording exam on John Smith on such and such date, and then you jump right in. First, relax your head and neck, and I'll test the flexibility in your neck. So they're moving the patient's neck, or they're moving their head, and the patient says, ouch, that hurts on the right side. So the patient, now I want to just emphasize this because as I taught you with the doctor's exam, when a patient makes a comment like this, you don't want to respond with, okay, You want to be careful of that. You would say, and then you would say, cervical right lateral flexion is limited 25% with pain, indicating subluxations. Go ahead and lie on your back. I'll guide you through the test. Tell me if you feel any stiffness or pain, okay? Does this hurt? And they're doing, maybe it says here, I'll guide you through the test, right? So if they're laying on their back now, right? We did sitting, now we did laying down. That hurts my hip on the left side. Maybe they're doing a Patrick Faber's test or something like that. That hurts my hip on the left side. Oh, here it is. Patrick Faber's test, sorry, I knew that. Is abnormal on the right, indicating abnormal hip function. Please stand up. Now, I'll guide you through this next series of tests. If you feel any stiffness or pain, let me know right away. And maybe they're doing lumbar range of motion, and the patient says, oh, that hurts. Or Kemp's test. Kemp's test is abnormal on the right, indicating a subluxation. This next test will test for a subluxation in your upper back, affecting your balance. Please close your eyes and walk towards me heel to toe. And then there's a footnote. I haven't been reading all the footnotes. I probably should, but number 4 says standing exam, and here's some. Actually, I'll go through these at the end because I knew that was coming, and I want to just reiterate what tests I feel will definitely show the subluxations. So Kemp's test is abnormal on the right, indicating a subluxation, and then this next test will test for a subluxation in your upper neck, affecting your balance. Please close your eyes and walk towards me heel to toe. And then the patient says, I can't do that very well. I see, right? I didn't say okay. I said, I see. Then please sit up while I document these findings. And then there's a minute where they're writing the findings down, right? They're not talking for a moment. It's just quiet, and the patient has a chance to reflect. Wow, I didn't realize all this was going on with my spine. Am I going to be okay? Now, CAs, hold back on this one because this is not the time for you to make a determination about whether they're going to be okay or not. It could be that when the doctor reviews the findings, there's something much more serious that comes out of them that wasn't even known about before that. So you want to give encouragement, you want to be optimistic, but you don't want to overpromise. I'll say that again. You want to be encouraging and optimistic, but don't overpromise because your words right now are going to be equated with those of the doctor. They're going to hold you right at that same level of authority. So you have to be careful about how you respond to those types of questions like, am I going to be okay? Well, I hope we can help you, but the doctor will explain the details at your next appointment. So based on your exam, the doctor is concerned and wants you back as soon as possible to review the results with you and your spouse. Now let's go through these footnotes real quickly. So the first one, number 1, let me know if you feel any tightness or pain. Perform the CA exam beginning with the location of the patient's primary concern and begin dictation. So we want to make sure if they came in with low back pain, that's where we're going to start the exam. If they came in with neck pain, that's where we're going to start. If they came in with wrist pain, we're going to start in that area, right? Always start with where their primary concerns are. Number 2, up here where it said cervical right lateral flexion, number 2 says seated exam for neck pain. And here's the example tests. So cervical range of motion is a great one. Shoulder depression is another one. You can also do cervical compression. Those are great tests that show when there's a subluxation. Then it goes into the supine exam, and the sample test here would be like a straight leg raise, or Braggart's, or Patrick Faber's, right? These tests are great during a supine exam to emphasize subluxations if they are in fact present. Then there's the standing exam. So sample test here would be lumbar range of motion, Kemp's, heel to toe for balance. And if you're not sure, excuse me, on the heel to toe, just watch the video and you'll be able to get a clear picture of what those tests involve. And then number 5, CA turns off the tape recorder and adds results to the consultation details while the new patient reflects on what they experienced. And then we escort them to the front desk for the new patient completion. Okay, so that's the script. Now the outline and script here goes back through basically the same thing, right? We continue the new patient exam, which is where the doctor left off. We perform the CA exam with these specific tests in the seated, standing, and supine positions, provide any additional testing, and then conclude the CA exam. So that's the flow of how those tests go. And again, it's so great because you're going to make such a memorable first impression with these tests. When you have a CA incorporating this part of the exam and being involved in the process, your patient will leave with a whole new understanding of what's possible through chiropractic care. And there's very few doctors that do this. So that's why it's this we call it a memorable welcome. They walk out and saying, wow, that's memorable. I've never had a doctor exam like that in my life. And, their assistant was involved. They have the whole team involved. I've never been through that process before. And wow, it was amazing. It was very memorable, right? So we want to have that impression with our patients. We want them to leave with that impression as they're leaving. Let's see. Oh, sorry. So from there, I think, actually, yeah, that concludes that. Let me go back here. I do want to just show you, let's see, where, on here. Oh, yes, I wanted to just show you this because we're going to have our next module, which is the report of findings module, will start on May 11th. So there's only 2 more weeks, and then we'll be starting our next module. We will not have a live seminar for that. We'll just transition right into the next module with our webinar series and our materials. But for the financial arrangement seminar in July, that one, I'm anticipating that will be a live seminar. So mark your calendars for both of those, but mainly for July, because I need to know from all of you, how many of you will be attending. It will be in Santa Cruz at my office, as we've done before. So I need to make sure that we have seating arrangements and food arrangements and make sure that it's a big day. So if you can please go on the website and go to training and then click on seminars and, oh, I'm sorry, RSVP, click on RSVP, and then scroll down to the July 13th seminar and just select in there if you're coming. So I'll click on my name, I'm going to register, and I'll click save. Now my name is in gold, and then we get a notice, hey, that you're coming. Or if you want to add in there, what, my CA is going to be coming with me. I'm going to register my CA as well, save that, and now we know, okay, we're reserving 2 seats for that office. So please help us out with that. That'll make sure that we have seating arrangements available. Once again, that'll be for the July seminar. And that's coming up very soon. But before that, of course, we'll have our whole report of findings series. And in conclusion, oh, and something, I apologize. I think that I wasn't sharing my screen. Sorry, let me go back. I apologize. Let me go back because I do want to show you here. Yes, thank you, Dr. Kanich. So yes, let me share my screen here. So what I was showing you was on the web page, the training, and then the RSVP. If you're going to RSVP, you just click your name, click register, click save, and now your name is in gold. If you're bringing a CA, then click their name, click register, and click save, and now we know there's 2 of you coming. If then Arlene decides she can't make it, or you decide that's not going to work, just click not attending, click her name, and then click save. Now she'll change to red, and it lets us know, okay, that person's not coming. So, so please use that. And backing up even further, because I didn't share my screen, I was looking over here on the side. Our next module will be the report of findings module, which starts on May 11th. The July 13th seminar is the one I was referencing that will be in person live. So, so with that, I think this is a good time to open up our lines for any questions. You can type in your question if you have one, or you can raise your hand, and I'll be happy to open up your line. Let's see. Actually, since you jumped out and let me know that, Dr. John, maybe I'll open up your line and just check in with you, because you always have good insight. There we go. You know what I love too, Dr. Kanich, is that your whole team comes on the webinars. You're very much a organized, proactive doctor, which is why you have such a successful practice. So congratulations. You there?
Yes, thank you. Hey, I was wondering if you could demonstrate what the finding would be with a heel-to-toe walk that's unsteady with eyes closed. You do that really good, and I want my staff to hear it.
So in other words, well, I'd be happy to, but in other words, so the patient just did the test and they lost the balance with their eyes closed. So right. In that instance, I will obviously make a concerned comment. Well, let's see. Let me see if I can do it this way, because I want to make sure. Yeah, let me do that and that. Okay, so so I would obviously steady them, because in that heel to toe test, they can lose their balance. They can become disoriented. They can even fall down, right? So I'm right next to them as they're doing the heel toe walk. I'm right next to them, not touching them, but I'm ready. So if they do start to lose their balance, then I put my hands on their shoulders. And by the way, I'm usually in front of them, I'm walking backwards. So the way that I can frame this is let me actually open up my screen here. There we go. Is if I'm coming, if you're my patient, right, and I'm walking towards you to demonstrate the test. So I've got my eyes closed and I'm walking heel to toe and I'm saying, as I'm walking towards you, I'm closing my eyes. I want to see if you can balance doing this test. So now I'm up close to them, right? Because I just walked towards them, demonstrating the test. So now from this position, they're going to demonstrate the test to me. So I'm walking backwards with them and I've got my hands ready so that if they do start to lose their balance as they're walking towards me with their eyes closed, heel to toe, I can quickly reach out and grab their shoulders and say, whoa. And so then my comment would be, wow, that wasn't normal. Gosh, I'm glad I caught you. You don't have to do the test anymore. And then that lets them know, well, this was an abnormal test. The doctor steadied me, but now I've got my eyes open, so I'm okay. And then that's the last part of the test. So I'll usually just guide them right over and say, well, do you have a seat here? I'm going to go ahead and write these findings down and document everything.
Okay. I thought we usually said those are signs of a positive cord pressure.
That part of it.
To that effect?
Yes. I'm sorry. I glossed over that. So yeah, because you are dictating it, I didn't dictate the findings. So as that happens and I steady them and I say, whoa, that was an abnormal test. Let's go ahead and have you have a seat here. And then I would turn back to the recorder. Heel to toe test was abnormal, indicating an upper cervical subluxation. And that's it. Or heel to test was abnormal for loss of balance, indicating a subluxation. And then that lets the recorder know what's going on.
Right. And if it's a staff, they would say possible subluxation.
Well, I said, good call. I'm glad you caught that. I said indicating a subluxation. So there's lots of indications of a subluxation, and a CA can say that into the recording. So there's an indication of a subluxation. Now the doctor's exam is different. There is a subluxation at L5, between L5 and L4, with an inflammatory response and tenderness to palpation, showing a subluxation with possible degeneration. See how I use those real key words. It's indicating it. Is it confirming it? We're not sure. So you could use that. I mean, if you want to be a little bit more vague about it, that's fine. You could say, suggesting that there might be a subluxation. That's okay. But in my mind, indicating a subluxation would suffice.
Great. Thanks.
Yeah, great question. That's perfect. And again, just my compliments to you. I see your team on the call too. And so it's great to have you and keep charging ahead.
Yeah, we all enjoy it, Scott. Thank you.
Of course. You're welcome. All right. So let's see. I saw Dr. Tetrault. You jumped off. So Dr. Mike, I was hoping to catch you. You jumped off. That's okay. I think your team might still be there, but that's all right. So I'm going to go ahead and wrap up a little early today, but it's a great topic. The CA examination. Let me just look because I thought I saw. No. Okay. Good. No hands up. Any other questions? Last call. But the CA exam just adds huge value to the exam process for a new patient. They are going to have a wow experience. They're going to have a memorable experience, and they're going to walk away with a new understanding of both chiropractic, but an elevated appreciation and value for chiropractic, so that when they come back for the report of findings and the path is laid out for them to get them well and keep them well. In DC trainings, we call that lifetime care, 1 year at a time. When that path is laid out before them, the value that we've created in this appointment, in this visit, is a huge part of whether or not they say yes or no. So we don't want to leave this out. This is all so important. And I know that, doctors, there is shortcuts we can take, or we can shorten things a bit. But remember, put yourself in the position of the patient and understand that they have a huge respect for what you're doing. And we want to elevate that respect into value so that they value what it is that they're getting. And of course, then they'll stay on long-term as great patients and get the best results and refer others as well. So it's been great to be with you today, and happy spring. And I will look forward to talking to you next week. And as always, if you have any questions, you can email me at dctrainings@gmail.com. Rock and roll.
If you would like to become a member of DC Trainings, be sure to head on over to dctrainings.com to get started today.